Most people have been wondering what arthritis is, and arthritis has been a common problem that we are seeing currently. And I would say it's because of the lifestyle that people are living in, and of course, the old age with the increase in life expectancy. Many people are allowed now 50 years and above, which is an area that is highly susceptible to osteoarthritis. So what's arthritis? So arthritis, generally we usually say anything that completes with itis in medicine means inflammation. So arthritis is the inflammation within the joint, and it will affect the joint structures. That means the joint structures will become inflamed. We have different types of arthritis, from degenerative like osteoarthritis to autoimmune that will come as a result of immunity problems like rheumatoid arthritis, others coming because of infection like septic arthritis, other coming because of also other infection in other parts of the body like psoriatic arthritis that will arise from psoriasis. So let's try and look at osteoarthritis. So what's osteoarthritis? Osteoarthritis is a degeneration process that will generally occur around your joint, and mostly it will occur to the joints that bear weight. That includes the knee joint, the hip joint, the ankle, the shoulder joint. Those are highly susceptible. So what are the risk factors that will predispose one to osteoarthritis? Some of the factors will include muscle weakness. So if you have muscle weakness around this area, this might predispose you, because the secondary function of a muscle is to protect a joint. So anytime a muscle is weak, it means that the protection of that joint has been compromised. Other things will include things like age. The more you get older, the more the degeneration process happens. It's a tear and wear within that joint. Other things will include like obesity, lifestyle, like smoking, people who smoke. Other things are nutrition. Poor nutrition may predispose you to that. Overuse of that structure of that joint might also predispose to you to that. So what's the role of physiotherapy in mitigating this problem? So one of the things that we usually say, it's educate your patient on how to prevent and provide education on how to ensure the problem doesn't progress into severe stage. So one thing, if you come to us, we shall do is ensuring that we do strengthening and stretching. So we have to ensure that all these biarticular muscles that are crossing within that joint are first strong. Second, they are flexible. That means we shall stretch them. Then the other thing is neuromuscular reeducation. That means these muscles, they are already weak. You haven't been using this joint because of pain. So we need to re-educate this joint back to its the muscles. We re-educate them for them to perform the function, which is the protection, which is the mobility. Other things will include things like low impact aerobic exercises. So for this patient, we don't encourage high impact exercises. So we need low impact. So we need swimming, we need walking. We need them not to do very high impact exercise, which will predispose them to further degeneration stages. So then other things maybe we can do is now neuromuscular stimulation, which we do with machines within our institutions. So that's generally what we do with osteoarthritis, and much more. We shall also educate you about the diet, about keeping yourself active and all that. So for rheumatoid arthritis, it's a very complex situation to manage, because for rheumatoid, not only will it affect the joint, but it will also affect the systems. So the earlier it is identified and you are put under medication, the better, because that prevents the progression of it to an extent. Now it affects the joint, the internal structures. So for rheumatoid arthritis, the 3 stages which will come there, whether it's synovitis, the inflammation of the synovium, whether it's the pinus, that means now that the inflammatory and the degeneration have really happened to even the stage of anchorizing, where now the bones will fuse and all that, and that joint will be stiff. So for rheumatoid arthritis, we'll always see them similar to osteoarthritis, but now for this case, we have to ensure they are under medication. They have to be under medication. They have to be under good nutrition. We have also to consider the psychosocial problems, because you are active, now you are not active. So we are expecting you may be having depression, anxiety, and all that. So we have to mitigate that. So we have said rheumatoid arthritis will also affect the internal organs. That means it can affect the kidneys, it can affect the liver and other structures. So it's good you go for screening as early as possible to prevent the progression. So other types of arthritis will include septic arthritis. Other things will include the things like psoriatic arthritis. But for those, if we deal with the primary problem, which is the infection, then we can be able to mitigate the arthritis part of it. So when it comes now to the management, the same way as we said, physio will be involved, physiotherapy, they are primary key clinician in this. Then we also have the orthopedic surgeon. In severe stage, they can do the arthroplasty, they can change that joint. Earlier they used to do arthrodesis, but they are not doing it, where they would fuse the joint capsules, the joint, the articular structure, the joint, they fuse it, they fuse the bones. But nowadays they will do arthroplasty and much more. So that's generally about arthritis briefly, and people should know that arthritis is not of one type. We have over 100 types of arthritis.